Hi, welcome to the Brain Injury Answers podcast. This is Dr. David Glazer, providing the answers you need when a brain injury occurs. This podcast is for educational purposes only. For treatment, please consult your physician. This podcast does not represent the Department of Veterans Affairs. All right, let's get started. Question: Dr. Glazer, how did you get into brain injury medicine? Answer: well, this is a very good question. It goes back to my 12th grade year of high school when I was in a psychology class taught by the very interesting and very dedicated teacher, Mr. Shaw. Mr. Shaw just made psychology and brain science come alive. And with that class, I took that passion of the mind and combined it with my passion for biology into the Ohio State University, where I studied neuroscience. At the time, neuroscience was still a fledgling field, and I had to design my own major in the field of neuroscience. As I continued along my neuroscience major, I started volunteering at the hospital, where, I also developed a passion that had been growing all throughout my days in school and in the Boy Scouts for helping people, and led me to going into medical school at Meharry Medical College in Nashville, Tennessee. So when I first started medical school, we all take the same first 2 years of biochemistry, anatomy, physiology, pharmacology, classes along those lines. And I always thought, maybe I'd go into psychiatry, maybe neurology. And when we did both those blocks of classes in our second year, I found the study very interesting, very fascinating. Kind of reaffirmed, hey, I better look into neurology some and psychiatry a little. Ended up doing rotations in them both and just didn't feel the fit. Didn't seem like it'd be exactly what I wanted. So I thought about primary care, family medicine, pediatrics, internal medicine. And then one day I was reading about different specialties online and came across a field called physical medicine and rehabilitation. At the time, I never heard of physical medicine and rehabilitation, also known as physiatry. So I started reading a little more online, started looking up who in Nashville, Tennessee is a physiatrist, and came across a couple physiatrists in Nashville. I sent them an email, reached out to them, and they said, come on over and come follow us, come see what we do. So I went over one Friday afternoon after an exam and got a little taste of it and decided, I'm going to do a 2-week rotation in it. So did a 2-week rotation at the Stallworth Rehabilitation Hospital. Basically, I spent my mornings rounding on the inpatient rehab unit, seeing all kinds of rehab patients, from spinal cord injury to stroke patients to just general debility patients. And I would spend my afternoons in various outpatient clinics, whether it was a musculoskeletal clinic or an EMG nerve conduction clinic, and I really found it fascinating how I could work with adults, I could work with children, there were procedures you could do, you could work in a hospital, you could work in an outpatient clinic. And it was from there I decided, I think I'll pursue this as a field. So I ended up heading down to the University of Alabama at Birmingham to pursue my physical medicine and rehabilitation residency. I really enjoyed it, learned a lot down there throughout the 3 years there, which occurred after a year of internal medicine at the University of Cincinnati, which really forms your foundation for the rest of your medical training and medical career. Knowing the basics of medicine will help you in any field. And while at the University of Alabama, Birmingham, also known as UAB, really found that I really enjoyed my brain injury inpatient and outpatient rotations and some of the procedures that go along with it. And this kind of combined my passion for rehabilitation, working with patients to improve their function. And in addition, it combined my passion for the brain and brain science and just the field of how much has not yet been discovered about the brain. And with that, I said, you know what? I think I'll spend an additional year doing a brain injury medicine fellowship, which led me up to Edison, New Jersey, to the JFK Johnson Rehabilitation Institute, where I spent a year learning about brain injury. I did inpatient brain injury medicine, outpatient brain injury clinics. I spent time at a long-term care facility for patients with brain injuries. I spent time learning various procedures that can help treat patients with various issues that result from brain injury medicine. And I also spent time at a level 1 trauma center performing consults on patients at the center at Robert Wood Johnson University Hospital, seeing patients in the ICUs, in the trauma ICUs, in acute care, in the emergency departments. And that's kind of what got me into brain injury medicine. And it kind of gives a little explanation of how I got into it. And as we answer more questions in this podcast, you'll get more of a taste of how I got into it and what developed, and really get a sense of my passion for brain injury medicine. That's a wrap for today. Remember to email all your questions to braininjuryanswers@gmail.com. Check out the website, www.braininjuryanswers.com. Thanks for listening.